Y bueno, mi gente, yo estoy muy contenta, muy feliz porque al igual que yo, muchas mujeres tienen el problema de venas varicosas, esas venas de araña que nos molestan, que a veces duelen, que nos sentimos feas cuando nos ponemos un vestido. Muchas veces tenemos que ponernos medias porque tenemos venas que se ven muy feas. Pues hoy tengo el placer de contar con el doctor Michael Kassouf, quien es cirujano vascular, tiene una amplia experiencia. Busquen lápiz y papel y anoten, porque hoy vamos a aprender todo acerca de venas. Bienvenido, doctor. Good morning.
Thank you, Jackie. Good morning.
Doctor, vamos a hacer la pregunta en inglés. Vamos a poner los subtítulos para que usted tenga la oportunidad de tener toda la información. Doctor, ¿qué son las venas varicosas?
First, I'd like to thank you for inviting me.
No, thank you to coming. Thank you to coming, doctor.
Well, veins, it's a blood vessel, and varicose vein, it's a bulging, it's an abnormally bulging vein from underneath the skin.
¿Qué lo causa? Why we have a varicose vein and venas de araña?
We have to understand the difference between varicose vein and spider vein, venas de araña and varicose vein. Varicose vein are usually due to venous insufficiency, blood vessel circulation, a circulation problem in the leg that can cause varicose vein. Now, what causes the circulation problem? There are many things that cause circulation problem. Could be genetic, could be congenital, could be an injury to the leg, could be blood clot in the leg that had developed in the past. All these things can cause what we call venous insufficiency, that are the cause of bulging veins, what we know as varicose vein. Now, venas de araña is totally different condition. This venas de araña, spider veins, are usually genetic. This runs in family. They are very superficial vein, barely visible, sometimes prominent enough to be visible to the naked eye, or could be very tiny or large enough. Usually we go in measurement by millimeter, from 1 to 3 millimeter, or sometime a little more than 3 millimeter. These are considered spider veins. They can be totally unrelated to any circulation problem. Now, people with varicose veins can have a combination of both, can have varicose vein and spider vein. So the treatment can become a little more complex, a little more demanding, and more difficult to explain.
¿Cuál es más común de las dos?
Spider veins are a lot more common, I believe, than varicose veins. Although varicose vein is an extremely common condition, because circulation problem is a common condition. But spider vein is associated with aging process, is associated with pregnancies, is associated with hormonal therapy, is associated with standing on your feet. So it's a very common, very widespread condition. People sometimes don't even notice that.
¿Cuáles son los síntomas de las venas varicosas?
The symptoms of varicose vein due to circulation problem are pain, achiness, heaviness, difficulty walking, tightness when you walk, swelling at times, and when the veins are very large and well developed, it can cause discoloration of the skin, ulceration, pigmentation, and sometimes blood clot. So that, this condition needs to be treated. This is something that people have to take seriously. Contrary to the treatment to the condition of spider vein, people can feel increased heat, pain, itching, throbbiness, but this condition does not affect the health of the patient. It's not the treatment is not medically necessary. Most of the time, it's a treatment that is considered cosmetic, and it does not really require extreme treatment to solve this problem.
Okay. I know many conditions, many factors can affect the varicose veins.
Yes, the condition, the factors that can affect varicose veins are, like I said, it's the aging process. You know, anyone who's progressing in age can tend to develop some form of venous incompetency. Now, this is very common in women because of the hormonal changes, because of the pregnancies and the number of pregnancies, and also because of people tend to work standing on their feet. Gravity pulls the vein out of the body and cause these veins to bulges and cause the discomfort that people have.
Oh, that's nice. Like me, you know, me pasó igual, estar trabajando parada mucho tiempo, pues normalmente. Pero bueno, el doctor ha hablado de todos los problemas que podemos hacer mujeres para tener unas piernas lindas, para poder lucir cosméticamente muy bonito. Nos vamos a una pequeña pausa, luego de la pausa continuamos más con el doctor Michael Kassouf, que está con nosotros aquí en casita.